Hi, everyone. Jeff Mann here, co host of Paul's Security Weekly, and we are at Black Hat 2023. I'm here this morning with Theresa Lanowitz. She's head of Cybersecurity Evangelism for AT&T. Theresa, good morning.
Hi, Jeff. It is great to be here with you at Black Hat 2023 in Las Vegas, where it is. I think we just checked. It's about 9 o'clock in the morning. 90 degrees, maybe?
90 degrees.
Yeah.
I almost put on a parka to walk over here today. It's so chilly. It's actually going to be highs of like 101, 102 today, which isn't bad
Not bad.
for Las Vegas, but definitely hot summer weather. Hey, we talked at RSA a few months ago, and we talked about the Edge Insights report that AT&T put out. But you have something new to talk about.
Yeah, so it's great to see you. Last time we talked was at RSA back in April. And when we saw each other last time, we had just launched from the AT&T Cybersecurity side, we had just launched our AT&T Cybersecurity Insights Report Edge ecosystem.
Right.
And that was at RSA. So here we are now in August at Black Hat. And what we have out right now is our AT&T Cybersecurity Insights Report, focus on healthcare. So the report we launched in April is really our core report. That has all the tons and tons of data. It's a 52-page long report. What we do over the course of the year is we create these vertical reports, which are really a double click on a lot of the information that we have in that core report. And we pull out some more information from the data that we've gathered on these specific verticals. So right now, today, we have the healthcare report. We're also coming out with one for U.S. SLED, state, local, and higher education.
Okay.
Later in the year, we'll have one on transportation. And later in the year, we'll have one on manufacturing as well.
Great. Hey, before we get too far into the conversation, either refresh for our audience their memories, or if they're listening for the first time, could you briefly tell us about this thing that you guys call the Edge?
Yeah, so our Insights report really focuses on the edge. And so just to set some context for our AT&T Cybersecurity Insights report, it's a vendor neutral, forward-looking report. And for 2023, we went out and we surveyed 1,418 professionals from around the world in areas such as application development, security, operations, networking, and line of business. And we surveyed those people in North America, Latin America, EMEA, and APAC. So it's totally a global survey. And what we wanted to find out was, what does their edge ecosystem look like? And to answer your question, what do we mean by edge? If you think of the word edge, we hear that word used quite a bit. And it's really sort of context sensitive. And if you ask 10 different people what the word edge means, you'll probably get 12 different answers.
Right.
And so for the purposes of this report, the purposes of our research, and the purposes of this discussion, we define edge computing as really being it's software defined, and that can be on-prem or in the cloud.
Right.
It's also about having the applications, the workload, the hosting closer to where that data is being generated and consumed, because the edge is all about data.
Right.
And then the third thing is it's a distributed model of management, intelligence, and networks. So if we think in the context of healthcare, think about any device in a hospital, in a doctor's office, it's internet connected, and you're getting information back from that. So that information has to be protected, it has to be usable, and it has to be trusted for that healthcare provider who's getting that information back.
Right. It's interesting that terminology is something in our business, our industry, that I like to focus on. I get a little bit grumpy about because I'm a curmudgeon. Those that watch the show know that, and I am always I want to use the right word, not annoyed, but passionate about the meaning of words and trying to get it in context. And like edge, so many other terms in our business, there is no one universal 100% agreed upon meaning. When I think of edge, I think back to, I came from a DoD background, and when this thing that we now call cyber was first starting, we called it internet security. We believed, corporations, organizations have networks, and they need to protect it with the perimeter, and there's an inside and an outside. Think a castle and a moat, and that's really blown up. That doesn't really exist anymore.
Right.
And so the edge is all the things, and I'm sure there's other competing terms out there that sort of describe more or less the same thing, depending on who the conversation is and what they're trying to help people in terms of solutions and tools. So that's to me what I'm hearing from edge. The fact that the data is out there, and who logs onto a network anymore? Everything's on their phone, on their laptop,
Right.
and so on and so forth.
And it's too slow to backhaul everything back
Sure.
to a central data center. And you talked about the perimeter or the castle and moat. That we know that sort of way, that network architecture is really no longer effective for what we're doing. And if you think about edge computing, the thing with edge computing is everything is changing. The network's changing. We're looking for networks that are lower latency, higher bandwidth. The applications, if you will, are changing. They're no longer these GUI-based applications where you have to be tethered to your laptop or desktop.
Right.
And it's not even about opening up a web app or a mobile app on your smartphone, for example, and typing something in. It's about near real-time digital first experience for that consumer.
Right.
And so everything is changing. So the applications, applets, if you will, they're ephemeral. They come together on an as-needed basis, deliver what you need. So we're moving away even from an application development perspective from these very, very GUI-based applications where we've been for, a couple of decades.
Right. Like the whole internet history.
Exactly.
Right?
Yeah.
So let's talk a little bit about the healthcare focus of your edge reporting and your surveys and what you've discovered. What did you find in your analysis that was the same with everybody else, but also what's unique and different in terms of the challenges and what healthcare, we all sort of intuitively understand that's a really big deal. We got to keep people alive.
Right.
But what did your analysis and your research just uncover?
I think the really great thing about our healthcare information that we have is that it's showing that the field of healthcare is at a point of incredible innovation brought to you courtesy of edge computing. And one of the things that we found that was similar with healthcare as well as the core report when we look at the aggregate, the total numbers, is that there is this balanced type of investment, consistency investment. So if we ask people where they were spending their edge budgets. And in the core report, people told us that 22% of their overall edge budget they were spending on security. 22% of their overall edge budget they were spending on applications. So that idea of everything is changing. 23% of their overall edge budget they were spending on planning, which is something that we have probably not really heard much of in the past. And then 30% of them said, we're spending that 30% of the overall edge budget is really spent on network. And if you look at healthcare, those numbers are very similar. But what we found with healthcare is there are 5 top use cases that the healthcare people who participated in this survey told us. And so our N for healthcare was 205. Our N for the core report was 1,418.
Gotcha.
So in healthcare, the top 5 use cases, the top use case that everybody identified in healthcare was teleemergency medical services, and then consumer virtual care, immersive medical training, robots and drones, which is really interesting, and then hospital at home. And if you take those last 2, robots and drones and hospital at home, they were spending a little bit more on the networking side, about 35% on the networking side, and they were spending a little bit more on the security side, about 23% of the budget on the security side. But there was still really that idea of we're spending on security, on applications, on the network, and on planning. And the drones and the robots, those are the really interesting things, because what we found out in this research with the healthcare portion of it is that endpoints are definitely changing. They're maturing. And 53% of healthcare professionals right now, they told us that the most common endpoints that they're using are mobile endpoints. But then they said, if we look 3 years out into the future, 5 years out into the future, we're looking at things such as drones and robots. We're looking at things such as wearables for remote patient monitoring. And we're already seeing drones and robots in use. So robots, very efficiently, delivering supplies to a nurse's station, disinfecting a room when a patient leaves, or disinfecting an exam room. The other thing that robots are really being used for, which is really a really interesting use case, we've all been in hospitals and we're looking for a specific area, and they tell you, follow the red line to the orange line to the purple line, and it's just this.
And you end up in the morgue.
And you end up somewhere where you don't want to be.
Right.
And so what some hospitals are using the robots for is directions. Have a robot right there in the hospital, and if you get lost, that robot can help you. Or maybe even that robot can actually take you by the hand and take you to where you're going.
Interesting. Out of curiosity, a lot of the buzz around healthcare, especially on our show, and we do news segments every week. Um, a lot of talk about vulnerabilities in medical devices, implants, pacemakers, and things like that. Did that show up in your research at all, or where did it fall in the pecking order?
Yeah, that definitely showed up. And if you look at these endpoints, because every device that's
So that's an
attached, that's an
endpoint.
endpoint, right?
Right,
So
yeah.
every device that's attached, you go into your doctor's office, you're paying your copay. That's an endpoint handled by PCI, payment card industry, right? And then you go
baby.
then you go into the exam room, and there might be something to monitor your vitals. That's an endpoint. You're in a
Right.
surgical situation. Maybe the surgeon's using some type of surgical instrument that is connected to the endpoint. Those are all endpoints that really need to be protected and taken care of.
Right.
And what we found from our research, and this is in the healthcare area, the number one concern of a perceived attack, we said to people, what do you think the biggest attack would potentially be on healthcare? And the number one perceived attack in healthcare was DDoS. And that correlated with the broader set of data as well. The number
Right.
one attack was DDoS. And you look at those types of things and you kind of think, well, everything old is new again. DDoS is making a comeback. But if you
Right.
think about all those endpoints, taking down those endpoints for even if it's 5 minutes, 10 minutes is really, really critical. And if you look at our top use case for healthcare, our top use case for healthcare was teleemergency medical services. And the top attack concern for teleemergency medical services was insider threat. So in healthcare, that insider threat really kind of rises to the top as well.
Interesting. Yeah, I mean, so much of our industry that we call cybersecurity, based on principles from, centuries ago, defense principles and things like that, and data security, where I cut my teeth in the early days working for the DoD, was all about confidentiality, integrity, and availability. Probably 90% of this industry for the last 25, 30 years is focused on confidentiality. So
Right.
the idea that availability now, I was having this conversation yesterday with someone where it's not simply protecting the patient data. The doctors don't care, the nurses don't care, the patients doesn't care. They want to keep them alive. So
Right.
they need to have the data.
Right.
They need to have the information. They need to have the medication dispensed and all that. That's got to be there.
Right.
It's the same problem, but a very different problem, all
Yeah.
at the same time.
Yeah. And I think you're right. So, as you said, about 90% of what we've done in the past couple of decades has really been focused on that idea of confidentiality. Let's make sure that we're keeping that data safe. And now we get to this idea of edge, where that is a digital first experience. The healthcare provider, a doctor, a nurse, they're looking at that information coming in on some type of vital monitor, on some sort of remote patient monitoring. So that data has to be trusted. Has somebody gotten into that data and
Yep.
done something untoward with it?
Yep.
And it also has to be usable. How can I use this data to make sure I'm delivering a better outcome for the person that I'm receiving it from?
Interesting. So, we're winding down now on our time. I wanted to ask, does the reporting that you do and the information that you provide, are you giving summaries and recommendations, or are you mostly just putting it out there and hoping that the readers will pick up on where you're going with it?
Yeah, as I mentioned, it's really actionable. So we give a lot of recommendations in there. And what I always tell people is take this report, take our core report, go back to your own organization and use it as a spark for a conversation within your organization. What we found is DDoS is a top attack concern.
Right.
We're seeing a lot of ransomware in healthcare organizations right now. That doesn't mean you can take your eye off of those things, but use this report as a starting point for the conversation. Take a look at some of the recommendations we make in it and go implement some of these things in your organization. I don't think anybody can say, oh, we have too much security in our lives.
Yeah, not really. Sort of my last question is, given that this is based on a survey, you came up with what bubbled up to the top is what organizations, healthcare companies are doing. In your opinion, is it right? Is it the right focus areas, or is there something missing?
I'm not a medical professional, so
Seems to be okay.
So the 205 medical professionals, healthcare professionals who took this survey, this is the data that they have given to us. So, and this is what we're reporting on.
All right, so best practice, consensus type of thing,
Yeah.
probably the right thing to do. Great. Well, thank you for your time. It was a pleasure to talk to you. Please look for securityweekly.com/ATT Cybersecurity BH for more information. Thank you.
Thank you.